This adorable baby is named Peter. He is 2 years old. He has AIDS. His mother carries the AIDS virus but has not developed the disease. She didn't know she was a carrier, here we go, until her baby was born and found to be ill with AIDS. Right now, there are hundreds of babies across the country infected with the AIDS virus. In no case has a child with AIDS infected a brother or sister or playmate. The misunderstanding and fear about AIDS are so widespread that even hospitals have difficulty getting proper medical and volunteer help to provide regular care for these sick children. Every baby like this one needs a loving presence, someone to caress him, change him, comfort him, and wipe his tears. Though the AIDS virus is found in body fluids, just coming into skin contact with these fluids cannot harm you. You and I cannot get AIDS by kissing or cleaning this baby. Yet so great is the fear these days that many people will be concerned that I am even holding this baby. To dispel unnecessary fears about AIDS, I spoke with Dr. Alvin Friedman Keene of New York University School of Medicine. Dr. Friedman Keene was one of the first physicians to sound the alarm that a new disease was taking hold in this country. Since 1981, he and his staff have cared for more than 600 AIDS patients. Doctor, the other day I put my arms around a 2-year-old baby who has AIDS, and the baby was perspiring. And later friends said to me, "How could you do that? What about the perspiration?" Should I have been scared?
Absolutely not. I think it was an admirable and marvelous thing for you to do because I think it demonstrates to the public that, which is appropriate, this disease is not spread by handling or fondling or being affectionate to a child with AIDS or an individual with AIDS. And I think that the chances of spread of the disease by that kind of contact is absolutely unfounded.
Well, let's go through that whole list of things that people are so frightened about. We hear that the AIDS virus can be isolated in saliva. Should one be worried about kissing?
We don't think so. There's no evidence that the disease has been transmitted that way.
Even deep kissing, soul kissing, they called it in my generation.
At this particular point, I can say that we probably don't believe that the disease is easily transmitted that way.
You're in a restaurant, and the chef may have AIDS and tastes the soup and puts the spoon back in the soup. Should you worry?
Several healthcare workers and other people have been concerned about this, but there's been no evidence that food handlers or anybody working in a restaurant, in fact, who have AIDS, can transmit the disease to other individuals.
What about sharing food?
There's no evidence that that's been a means of transmission.
Suppose someone sneezes on you or at you.
To date, again, there's no evidence that the disease is transmissible by that kind of exposure.
What about tears? I mean, can you get it from wiping someone's tears?
We know that the virus has been isolated from tears in a very few patients, but the quantity of virus is extremely minuscule in saliva, in tears, and we doubt that that's sufficient enough for transmission of the disease.
Can AIDS be spread in swimming pools?
I doubt that, and most swimming pools have chlorine in it, and this virus is especially sensitive to a dilute solution of chlorine, so we suspect that the chlorine used in water would prevent the spread of the virus.
Can AIDS be spread on toilet seats or locker rooms, restrooms?
There's no evidence that that's ever been demonstrated.
Well, doctor, you keep saying no evidence, but that kind of scares me. I mean, no evidence may mean it can happen, so therefore you shouldn't kiss, and you shouldn't use the glass, and you shouldn't do some of the things we've talked about.
I've worked with patients intimately over 5 years.
How many patients?
Over 600 patients. And my blood tests are checked every couple of months, and I'm still negative for the AIDS virus. All the people who work in my laboratory and work with my patients in the most intimate possible way in dealing with their blood, vomit, nausea, stool secretions and other things are still seronegative, which means that their blood tests are still negative. This virus is extremely fragile and just doesn't get transmitted that easily, except by the most intimate circumstances as far as the evidence goes.
We know that heterosexuals can also get AIDS from sexual contact if they're with someone who has it, and prostitutes may be carriers. What can one do to protect oneself?
I think what we've got to do is to educate people about using condoms and other protective mechanisms so that perhaps this would provide some protection. We are not 100% certain that that alone is sufficient, but I think it's certainly a step in the right direction.
What about the use of vaginal jelly?
Vaginal jellies do contain an antiviral agent, and anti-spermicidal jellies do have an antiviral substance which may have some effect on the virus, but this hasn't been tested really yet. And I don't think that one should rely on that alone.
Can you rely on a diaphragm?
I doubt that.
So the main thing that you're saying is you should know who your sexual partner is very well. You should limit your sexual contacts. And if you are going to have sexual contacts, then you should use a condom. Or if you're a woman, have the man use a condom.
I would think that's true.
What about sending a child with AIDS to school?
No one's gotten AIDS from a bite or from abrasions or by cuts, exposure to the skin. And as a matter of fact, we've never been able to even isolate the virus from feces or from urine. So that I suspect that in such a case, the child with AIDS could safely play with other children.
The ones that you're worried about are the older children, the teenagers who may have sexual contact.
Yes. Nobody's paid attention to that, and I think that's a major area that needs to be looked into.
I understand now that you're seeing new kinds of symptoms from AIDS.
We're seeing things like loss of memory, loss of ability to walk properly, of convulsions, of neurologic diseases similar to almost multiple sclerosis, of weakness, of unexplained origin, of hemiparesis, a kind of paralysis like somebody who's had a stroke.
I've been having trouble with my legs, and it's been harder for me to walk.
Billy is only 26 years old. He has central nervous system AIDS. Doctors used to think that the AIDS virus attacked only the immune system. Now researchers like Martin Hirsch, Billy's doctor at Massachusetts General Hospital, have shown that the virus attacks the central nervous system as well, the brain, the spinal cord. Just a year and a half ago, Billy felt fine, except that he noticed a tingling in his foot.
It's included the front of my foot, the back of my foot, and now it's going up my legs. And it's very, very painful, and it's the sensation of your feet falling asleep. I mean,
Billy has lost close to 40 pounds since he became ill, and as if the debilitation and disfigurement from AIDS weren't tragic enough, he now faces dementia if his brain is further affected.
It's hard for me to recall, it's hard for me to speak, it's hard for me to write, and I've been misspelling things, and it's been a problem.
Do you often forget in the middle of a conversation what you're talking about?
All the time.
That happens a lot?
All the time.
Though the future looks grim for patients like Billy and for Peter, a major breakthrough has been achieved here at the New England Primate Center. Doctors Norman Letvin, Ronald DeRosier, and their colleagues have been able to infect young monkeys with an AIDS virus, duplicating the disease in the animals.
We feel that this is a very, very important finding and might well open the door to developing new treatments for AIDS by giving us a model in which one can experimentally test under controlled circumstances new antiviral drugs and new vaccines for AIDS.
But why experiment on animals when so many AIDS patients are desperate to take any chance they can get?
The problem with working with people is that individuals who are suffering from AIDS might have contracted it at different times, might have been harboring the virus, some for a few months, some for a few years. Having an animal model wherein one can experimentally inoculate an animal, therefore infect him at a known time and initiate treatment at a known time in relation to that experimental infection, one has a very controlled, careful way of evaluating the efficacy of a treatment.
Though science continues to advance, estimates are that millions of people will be infected with the AIDS virus before any cure or vaccine is found. What do you need most to help you in your work?
In order to do the testing that's necessary to evaluate antiviral therapy with the new drugs that are potential treatments or cures for this disease, we need to have laboratories readily available around the country to provide us with a way of testing those individuals who may be carrying the virus and those who have the virus who are receiving treatment to see if the treatment's working. No.
We're in such a panic over this. Are you worried about what this all means to the AIDS victim?
I'm very concerned, and all of us who take care of AIDS patients are worried because we realize that these patients suddenly feel ostracized, treated like lepers, and being almost excommunicated from their community. I think that it's terribly important that we all develop the kind of Christian compassion for caring about people who are sick and who are dying of a disease like cancer or any other disease, who deserve absolutely the maximum amount of concern and affection and interest.